So when they see the journal, they understand, I eat dinner so late every day. I drink it 3 times a week because you have journal. Sometimes you let yourself go just because of desire. Also emotion drive. No problem, I can eat late tonight. Oh, I'm so hungry, I have to eat. Oh, I'm working too late, I have to eat late. Oh, I have some meeting me so late, I have to eat. You have tons reason to eat late. So until you recognize, oh my God, my body, the health issue started. So that's very late. So for patient, you have to manage this kind of situation. Never eat late. No heavy dinner after 7:30 or 8. Know that. If you eat, it's okay. Eat lighter. Eat light, salad, fruits. Let the body feel hungry at the morning. You can eat a big lunch, but no late, heavy dinner. Not just for losing weight, also for the energy, the training. So that's the eating pattern. We have sleep pattern situation, sexual activity situation pattern. For female, also related menstruation, related body energy, related moodiness, emotion. Everything you can make a pattern for yourself and make the bad solution. That's the problem. Bad solutions. So later, when we recognize your pattern, we know, you are in this situation for a while. So that's why in Western medicine diagnosis anxiety, you know the pattern, you just a few questions. You can recognize this situation, not just reason. They say diagnosis 3 months, 6 months, 1 year. So you check the lifestyle, you know that's not a 1 year situation. So you can ask more questions. They can tell you more information back years ago, even from the teenager or even from the childhood, clearly. So that's the pattern. Recognize the pattern, because that's one day we will have to do this. We don't do too much talk. That's understand here. That's fine. Also in a different prognosis. Basically, if you have good energy, body energy, you have the good compliance, you can make a good relationship with the patients. Also, patients feel something motivated, or you can let the patient on your treatment track and continue moving. Basically, prognosis for anxiety, not a big deal, no problem, but just need your patients to handle. If you cannot handle the situation, or patients, the anxiety may be just a secondary or some bad situation beyond anxiety, that possible is tough. That can be tougher. Or the reality, the situation, actually no solution, something very bad. You keep doing your best job, maintain a certain level, that's okay. Maybe the prognosis is still tougher. So we have one lady, abused by the guy, married 10 years. Every time she want to make a decision, divorce, but every time he forgot it. She tried, oh no, I have to come back. And then crying again. And it continue more years, more time, more crying, more anxiety. But also doesn't want to make a final decision, divorce. But the guy is still abusive. So we treat her also, maybe, ask her, let your husband come, but never, acupuncture, what's that? Never go. Also don't go see doctor. But go out do his job, but later, abuse the wife. So that's kind of bad cycle. It's very hard to handle. But anyway, we have to understand that's yourself, your health condition. You have to take care of yourself first. You have to make your own decision. By the way, we never tell patients, say, going to divorce, that's a bad guy. No, we don't never involved in the personal decision making. We don't touch any legal conditions, right? That's the principle. But we tell patient, you have to make a clear decision. Is your health issue, your health situation can maintain this way forever? You think you're tolerable for this situation forever? Or how about your future when you think yourself? Your health is number one. This kind of abuse situation, how do you think about it? Did you ask any social worker or some psychotherapist to help you to find a solution? Or you tell someone to stop abuse? Or try to reach someone somewhere they have association certain way to help you stop this kind of situation. You have to make a decision by your own. So that's our basic, the principle here, right? So we never tap in, the bad guy, divorce right away, divorce. So later you have to write a paper or say something, or patient is weak, right? Patient is weak. They go back and say, oh, my daughter said it, a divorce. So you trigger many situations. Nobody do that. But overall, let the patient make a decision by their own. But let them understand, we do the healthcare. Your health condition is the number one. We call that the root. You don't have a health condition, you got sick or maybe going to die. What's the relationship? What does it mean? Nothing.